My name is Jen Rohde, and I'm doing this PowerPoint on medication administration errors. What is a medication error? Basically, a medication error is any inappropriate medication use that could lead to the harm of a patient, which could have essentially have been prevented. Medication administration errors may be more common than any of us could imagine. A new study reveals that each year, preventable adverse events, PAEs, lead to the death of 210,000 to 400,000 patients who seek care at a hospital. This makes hospital errors the third leading cause of death in the United States, following heart attacks and cancer. Medication administration route errors may stem from many different things, including but not limited to illegible handwriting. Using computers and such can help to eliminate some of that confusion, but whenever a doctor's order is handwritten, that leads to confusion if the handwriting is not legible. The look-alike, sound-alike medications. Clearly a lot of the medication names look alike or sound alike, but can have very, very different needs for these meds. Incomplete orders are also a cause for errors. Lack of information, whether it be regarding the medication or lack of information regarding the patient. Dosing miscalculations when dispensing. That huge error problems could lead to the death of many people. If a decimal is in a different spot than it should be, can lead to a huge error. Administration errors, transcript errors. Make sure to always follow the proper procedures, the 6 R's, the right medication, the right dose, the right route, the right time, the right patient, and the right documentation. Use of inappropriate abbreviations. Oftentimes medical staff will assume that others understand their abbreviations, which can lead to a huge disaster. Many people in their mind think that something may be the proper abbreviation when it can mean something entirely different and can be interpreted quite differently. There can be a number of causes to the wrong medication administration route. A few of these causes: stress in the workplace. Obviously, things like especially urgent cares, emergency rooms, things like that, where everything's very high-paced, can lead to a lot of stressful situations which can cause errors. Miscommunication between whether it be staff or between staff and patient, that can be a huge thing. Distractions, exhaustion, interruptions. According to one of the websites I was researching, a study done from September 2006 to March 2008, 12.1% of medication administration errors were due to interruptions. So it's important that we can find a quiet location with minimal interruptions so that we may focus on medication, what we're supposed to administer, how we're supposed to administer it, and so on. Effects of medication administration errors. When it comes to the effect on the staff, that may include anything from suspension from employment, termination of employment, or loss of nursing license. Effects on an organization can include things such as the facility being viewed as incompetent, poor rapport between employees, loss of facility license if it's serious enough, and the effects on patients and possible risks with administration errors: possible allergic reactions, possible injuries as a result from the incorrect medication, and obviously the worst could be possible death. So as we can see, administration errors, medication administration errors are huge and can be deadly. So we need to make sure that we're taking our time and focusing as hard as that